Good morning or good pre-afternoon or something, and welcome to this, as I think, very important, one of the most important sessions about effects on health inequalities. We heard a very interesting discussion earlier about the health inequalities, and also if you can look at it from different angles, that is that you can find different results and also new information, which is extremely important to us. We are now, and I look forward to listen to our very skillful speakers here today. But I just would like to add one sentence, and I looked in the preparation for this, and that is, prevention alone is not the panacea, and we need also to address the health inequalities faced by patients diagnosed with a chronic condition and their families throughout Europe. We're talking as the countries consist of a homogeneous group of patients or homogeneous group of citizens, when in fact there is enormous heterogeneity, and we have to address that. We have two very skilled, as I said, speakers today, and I'm very proud to announce the first one, Žilvinas Padaiga. Something. Sorry for that. This is my first time in Lithuania. I just learned to say thank you, and it's very strange. I'm working on it. I don't know if you want to be presented as a former minister or as a skillful professor. Which is highest ranking? I don't know this time, so please, the floor is yours, and welcome again.
It's on my screen.
It's not here.
It's here too.
No, it's delayed. It went through.
Okay, good morning. I'm excited to stand in front of you, and as always before presentation I'm a little bit excited and scared, but once I start then everything is okay, despite 20 over years of lecturing. I'm very happy I got this space to express my own opinion about fighting the health inequalities, erasing or reducing them. And to my understanding, what I was trying to say in my question in the previous session is that we are behaving a little bit in a wrong way. Well, me personally, I'm sure that it's not the health sector who is responsible for creating health inequalities. I do not mean that we do not expand them, we do not make them even bigger. Yes, we do, as it was shown in those excellent previous presentations. But it's not us who created, because the profession itself, the values of the profession itself, they clearly state equal from oath of Hippocrates. Me personally, I'm a little bit, actually sometimes too much fed up with the research data and more research and sophisticated research, and at some point being academic, at some point I cannot grasp all these sophisticated comparisons, which actually mean the same, that there are health inequalities, they're increasing despite all the work being done. And the first study on health inequalities in Lithuania we did in 1997. It was commissioned by World Health Organization, and we saw health inequalities at that time. And despite several political declarations, these inequalities, not only in Lithuania, in other countries, they continue to expand. Is there something to be done about health inequalities? Well, I don't think that much can be done by health sector, and that's my reserved understanding of current meeting and current discussions. I remember from the politics, and I see it's exactly the same, every time healthcare sector is taking responsibility for health inequalities, other sectors, especially politicians, are very happy, and they are really encouraging us, and they say, yes, go for it, do that. Well, we give you full support. Support is never more than 5% of GDP, and there are also even more obstacles coming with economic crisis. And then after 10 years of implementing, let's say, Lithuania National Health Program, we are being blamed that not much has been done. And then we say, oh wow, we are bad, and we blame ourselves, and we continue to say, yes, we need to make it better and better and better. So my short talk will be a little bit focused on health inequalities with the example of mortality of cervical cancer in Lithuania. And then basically I want to also to provoke the discussion, basically what can be done. And a little bit of data, or it will be very short because, as I said, I am quite fed up with the data. You see that standardized annual mortality rate from cervical cancer in Lithuania, and this is by educational level, which was missing in the previous presentations. It shows exactly the same. It's the higher education we have, the less risk of mortality from cervical cancer in Lithuania exists. If we go on trends in standardized mortality rate from cervical cancer by educational level, comparing up to secondary and post-secondary education, we see that there is quite a gap. And if you remember, we started screening program for cervical cancer in 2004, actually, when the rates were really high, 30 for up to secondary and less than 2 times in post-secondary. And in more than 5 years' time, not much has been done in this age group. 27 is not much less from 30, and 10 is quite more less than 15. So exactly the message is the same. The groups with high education, they are uptaking the offered preventive programs, offered healthcare services, and the gap is actually widening. We see it in Lithuania the same. This is rate ratio, and we see that inequalities are increasing from the time when we started screening program for cervical cancer in Lithuania, and we are very successful in widening these inequalities. Yeah, we are doing great, despite we are providing the services, but yes, we are doing bad on increasing health inequalities. Okay, that's it for data. And right now I'm working at Lithuanian University of Health Sciences, and recently I started also a position at University Hospital of Lithuania and Hospital of Health Sciences. And we started to think about the hospital. Kind of, we do not have much ambitions to influence the whole sector of healthcare, but we started to discuss with the hospital, and here we have the general director of the hospital and rector of the university sitting here. What can we do within our hospital? And we were asking ourselves, what are main indicators that inequalities in cervical cancer mortality and any other health inequalities will continue to increase? Any suggestions of the audience? What would you take as an indicator which would show that inequalities will continue to increase? Like, this might be sophisticated one, might be very simple one. Any suggestions? No big scientific studies being made, like daily thing which everyone knows. It exists or it ceased to exist. My understanding that this is very, very simple indicator. Phone calls to outpatient and hospital administrations by politicians, friends, and relatives asking for help. Very simple. And the next, what we are doing as administrators, we are providing help for these calls. Recently, we had a visit of chief physicians, general directors of hospitals from Kazakhstan, really huge hospitals. And we're having conference and seminars. And in the beginning of the day, they were all busy on the phone. And someone was calling them. And then in the afternoon, they were calling someone. And I was saying, well, what are you doing? I said, it's our job. In the morning, we are collecting wishes. And in the afternoon, we are reporting the results. So it's not as bad as this in Lithuania. But my understanding, if at least for 1 month, in our university hospital, well, it's a dream, it's illusion that in all hospitals all over in Lithuania, for 1 month, nobody would call the general director, administration, heads of clinics, then there would be a big success, kind of. Then I would say that everyone has exactly the equal right, equal access to healthcare. What are effects of inequalities? Because the session is called on effects of inequalities. And effects, I think they are devastating. Well, inequalities existing by itself, to my understanding, they are further increasing mistrust in the health system. If I'm living in the village, if I'm less educated, the income is really low, I don't know anyone in the system, I really shrink. I really think, wow, there is no hope to get anything. And then I go when I'm close to death, basically. And population with lower socioeconomic status, they are losing more years of life. It was beautifully shown by Reinhard Busset. Quality of life, it was also shown. Jobs, income, ability to educate children. And then this is a vicious circle, and the society is going apart very fast. I'm professor at the university hospital. So if I feel a back pain a little bit, I can get magnetic resonance the same day. I hope so. Perhaps they will say, yes, go, come, we will find the space. Sorry for making it really kind of extreme cases, but a person from the village never will be able to do this. And increasing burden of health and social systems with late diagnosed cases, these cases are coming to our system, and then anyway, we need to deal with them. And kind of we see many people like that around and within our university hospital. So basically, I want to provoke the audience discussion, what can health system do to raise inequality, and not only in cervical cancer mortality. Me personally, I do not have sophisticated answers for them. As you saw that Professor Mackenbach and Reinhard Busset, who are on the scene for the last 20 years dealing with health inequalities, they were not providing any quick fix and even long fix solutions for reducing health inequalities. So maybe there are really some good ideas where we can start at, and I leave this with a question mark. I don't know where to start from. Thank you.
I wonder what you have been answering if you still were the minister, and I would ask you, please fix these inequalities that are drifting apart. What would have been your answer as a minister, with all the pressure on you to deliver as a minister in order to remain the minister and not be kicked out?
You want an honest answer?
Yes, honest answer is good.
I would say I have created the working group, and we are working on developing of
Yeah. No, that is the next level, committee. First working group and then committee. Okay, but say it was an election year, because then you don't have any time for working groups or things like that, and you have to be energetic and trustworthy.
Well, the really nice experience we had at the time when I was working at the ministry, and I was very lucky because the whole university was supporting me, and it was very, very easy to get the answers to the questions which I did not know. We organized in 2005 the intermediate evaluation of Lithuanian health program. And then we were successful to invite to this conference, and it was held in the parliament of Lithuania, 6 ministers, like social sector, education, environment, finances, etc., and asked them to present what these sectors did to improve health. And in the beginning, when we spoke with these ministers, they were really lost, and they were asking, why are you inviting us? Are we really have to do something with health? And then I said, well, we will deal with your managers and other politicians. We will help to report on what you are doing on health. And then the day came, and Prime Minister was there, and the ministers were reporting what are they doing for health, and they were feeling very proud, kind of. They understood that they are actually doing something for health, and for them this is a very special thing. Oh wow, we are really contributing for better health. But in fact, what I see that these intersectoral activities are not very frequent in Lithuania, and sectors tend to reject each other and to blame each other. You are not doing good, you are not doing good. So it was quite a positive experience.
Okay. Maybe you will be re-elected, I'm not sure yet. I have to think about it, because the present one is ambitious, and we have to give him the chance first. Do we have any questions from the audience? Have you waked up now? You're fine? He's telling you that there is no quick fix, and it's not enough to letting the healthcare system fix it themselves. You're fine with that? Peggy, can we have a microphone? There is a microphone, okay. I didn't see the trees for the wood. Okay.
Peggy McGuire, European Public Health Alliance. Thank you very much. A very, very interesting presentation on...
Don't speak so quick.
My Irish accent.
English is not my native language.
Okay. Thank you very much. A very interesting presentation. Yeah, I mean, I think with cervical cancer, I think you talked about the burden and the devastating effect, and it is devastating because cervical cancer hits women at a very, very vulnerable age when they're in the middle of raising a family, and I think it's a dreadful, dreadful situation. And the sad thing is cervical cancer is completely preventable with a combination of screening and also vaccinations. And really, there are models of good practice out there on what is happening at a European level on the introduction and implementation of very, very good screening programs. And these should definitely be looked at. And in the reduction of inequalities, there are also very, very good examples in member state level of how to reach and how to remove barriers in reaching hard to reach groups. And I do appreciate that there's a resource poor allocation and there's lack of resources at a national level. But I mean, I think Martin Seychelles yesterday, maybe we should be looking at structural funds and how to impact on infrastructures at national level.
There was no question in that, was it?
My question should be, should we be looking at the models of good practice that are out there already? And should we be assisting member states who haven't implemented good screening programs at the moment?
Yeah, the answer to that, computer say yes. Computer say yes. Okay. Anyone else? The dare?